So contextual safeguarding is an idea that if we want to protect children who come to harm beyond their family homes, we need systems that are capable of targeting any context where they come to harm. So not just the family, but also peer group, schools, public spaces, all need to be able to be targeted by a safeguarding response. That we need to apply child protection legislation and policy to extrafamilial contexts, not just family ones. That we need to work in partnership with people who have a presence in extrafamilial contexts and young people in their families to respond. And we need to measure our impact. Contextually, we need to measure our impact on context, not just on individual people. So that's what contextual safeguarding is. In terms of how it applies to children in care, and in a number of ways, but I think the points that really come to my mind are the care system, like our child protection system, is designed on the idea that children come into care because they've been unsafe at home, whether that's because of action or inaction from their parents or caregivers, or because of a tragedy like a bereavement or something. That's why they've come into care. Whereas children impacted by extrafamilial harm can come into care even though they're living in a relatively safe family home and have relatively safe family relationships, but their parents or carers may just be unable to protect them where they are living at the moment. Sometimes we see whole family moves, but parents often have jobs, younger children, and so the child who is vulnerable to extrafamilial harm will be the one taken into care and moved. And that means that the whole idea of care, that you were unsafe and now you're safe because you've been placed into care, doesn't work often with extrafamilial harm, because you can be relatively safe with your family but not where your family lives, and then still be unsafe when you're taken into care. And the things that were protective, like protective family or any protective friends or close relationships with professionals, are often lost because you're moved a significant distance away from that area to get you away from the harm. So the way contextual safeguarding questions assumptions about child protection systems also questions assumptions about the place of care. Ideally, when you increase a contextual response, you respond to the locations where children are unsafe, you should reduce your reliance on care. You should reduce the need to move children away from harmful environments and into care, because you're creating safety around them where they are. So that's one of the kind of main goals of contextual safeguarding. But it also means that if you have to place a child a distance from their home community, even if it's for a short-term period, for their own welfare, that you would need to be considering the environment you're placing them in, not just the environment they've been placed away from. And we know that some children who come into care due to harm within their families then experience extrafamilial harm when they're in care because of the area that they're placed in or the friends they make when they're there. So it really encourages us to think about the places we're moving children from and whether we can create safety within them so we don't have to move them into care. It also encourages us to think about the areas we're placing children in and the extent to which they have access to safe friendship groups, whether they're going to be safe in education, what are the safe public spaces they're going to spend their time in, so they don't encounter extrafamilial harm once they come into care.